The practice here is basically a rural practice. We do general ophthalmology. We see a little bit of everything. We do a lot of routine refractions, but we also see farm injuries. We see a lot of elderly folks who have cataracts and glaucoma, and basically just do a little bit of everything. Well, I believe we've had the machine less than a year now, and most of the procedures that I do are primarily glaucoma. Probably, well, almost everybody has been on medication first. It's unusual to do, for this practice, to do it as a primary procedure with a new diagnosis of glaucoma. So in general, it's used in addition to medications. Certainly there are some patients who can't use medications or don't use them well, in which case we very rapidly would go to doing something like an SLT. But the majority of them are, the procedures are for patients who either haven't responded well enough to medications or are progressing despite medication. This laser, I believe, has helped management of patients. It is a very simple thing to use. It's also an easy procedure for the patients. More people are hearing about this type of procedure and patients are more open to it. I found that compared with doing previously argon laser trabeculoplasties, that I do the SLT more frequently. It's an easier procedure to do. The patients seem to tolerate it very well. And clinical information about it is that it can be repeated, whereas with an argon procedure there were some limitations and a number of times that you could do the procedure. So I found that I have in fact been treating people with the laser earlier because it is a simpler thing in many respects to do. The patients are very accepting of it, and I know that if it needed to be repeated, it could be done again at a later date. I think that it's a good idea for a lot of reasons. It's good for the patients because it helps improve the glaucoma care for the patients. It's good for the practice because it allows you to treat more patients within the practice rather than referring them away for this procedure. And it's a simple procedure for a general ophthalmologist to do. The Duet is very nice. I had an older YAG laser that was sort of on its last legs I'd had for many years and needed to be replaced anyway. And so it was very convenient to get a machine that was both the YAG and the SLT. This machine is also just very convenient in that the table is very versatile. And we see a lot of elderly folks and nursing home patients who are in wheelchairs, and this can go down very low, and we generally don't have trouble with the wheelchair patients. With the old machine that we had, some patients we couldn't get up to the wheelchair, and years ago, before I had my own machine, or in one of the satellite offices also, we used to have one of the services that would bring a laser in, and many times we had problems with the patients in the wheelchairs, so we couldn't get them up to the machines. But this machine has worked very well for that. It saves space. My old machine, of course it was an older model, so it was larger. And this is a very compact machine. And so we have one machine instead of having to have two. We do have other lasers. We have an argon in the other room. We have cameras. We have the visual field machine and the HRT. So we have a lot of equipment around. And it's very nice to have one less machine. Having the versatility of the different wavelengths, and that is to do the YAG procedures versus the SLT, is very convenient, having one machine that has the capability of doing all those things. Even though I'm a general ophthalmologist, I see a lot of glaucoma patients, and I found that before buying the laser, I was having to refer a lot of those patients out of the practice. And I certainly still refer difficult glaucoma problems or people who don't respond and so on. But this way I'm able to keep many of those patients in the practice, treat them myself, and give them the best care possible without having to send them to a specialist. Well, the company's really been very helpful right from the beginning. When I originally contacted them that I was interested in an SLT, I wasn't really familiar with the different models, and they sent somebody out actually with a machine to come to the office. They showed me a portable model. We talked about this duet. There also can be an argon laser added onto it, so you can actually put a third laser into it. And so they really gave me a lot of options. They gave me a lot of information about what was available in the field and helped me make that decision as to what machine would be appropriate for me and for the practice. And we've been very happy with it. Since I got it, again, we had a very nice installation. We actually had the local rep plus the gentleman from the New York City area who had done duets before. And so I actually had kind of a team come to do the installation. They let me practice on the machine. They help set it up and so on. Also, the company's been very good about coming for maintenance and, you know, making sure that the machine is focused correctly. And I've had them out a couple times. We've done routine maintenance, and one time I had a problem, and they were very good about coming out, taking care of the problem right away and fixing it. In many situations, a brochure is very helpful. The patients come to the office and you tell them they need a laser treatment, and that's kind of unnerving and upsetting for a lot of people. And many times they don't remember what you told them. And you explain about what the disease process is, and you explain about what the procedure is that you're going to do to treat it. And they go home and some other family member asks them, well, what did the doctor say? And they say, well, I don't remember. Or they'll tell them something that's only half the situation. And having the brochure allows them to go and look at that, and they say, oh yeah, I remember the doctor said that. And so the brochure is also a reinforcement of what the doctor has discussed with the patient, and it's an objective thing for them to look at for separate or later reference. Perhaps for the business, price is always an obstacle, and obviously the duet was a more expensive variety of the machine, but it's also less expensive than having to buy two machines. So if I had to replace the old YAG and buy an SLT, it was in fact, it was cost-wise appropriate to get the combination machine, and it was less expensive than buying two. They informed me that a machine like this was available, and as I said, they told me it was available with the SLT, the YAG, and the argon as options on the machine, and I knew that my YAG laser, although it was working fine, was a very old machine and was looking to probably need replacing shortly, and rather than wait for that to break down, I felt that this machine was a good option, that again in the long run it would cost less to buy this machine than to wait till the other one broke down and then have to replace that also. And as I said, we did have the problem with positioning some patients that really was eliminated virtually with this machine. I found that the SLT is very effective in helping with care of glaucoma patients, and I've had very good results with it. It doesn't work for everybody, but most patients do get a significant decrease in their intraocular pressure with the SLT procedure. So I have been very pleased with that, and in general patients have been pleased with it also. The YAG component is also very easy to use, and patients are very grateful after a YAG capsulotomy because their vision is significantly improved. Well, working with Luminous has been very helpful to me personally. The company's been very supportive in providing me with information as to the workings of the machine, the limitations of the machine, the advantages of the procedure. And SLT is certainly still a growing procedure. There's a lot of procedures that are being done. It's been it's shown very good results in terms of IOP lowering, and has the advantage over argon of being repeatable. Luminous has also, as I said, helped with my choice of this machine. That in my practice, the flexibility of doing both SLT and the YAG with the single machine has been very helpful, and they've been supportive in the in patient support also, in terms of the brochures and so on that they've provided, and it's been a great machine. I really enjoyed having it and using it, and it's been a plus to the practice also, just in the terms of not so much advertising, but that people hear that you have a new machine. And when I'm able to say that I'm the first duet in Western New York, you know, not that people don't have SLTs and YAG lasers, because certainly they do, but it is an upgrade to have the machine with both. It's very compact, and it's movable.